Hello, my name is Nikkhah and I'm here to present our paper Family Care Coordination in the Children's Hospital, Phases and Cycles in the Pediatric Cancer Caregiving Journey. This work was done together with Swaroop, Krishna, Yalamarti, Dr. Emily Mueller, and Dr. Andrew Miller from Indiana University at Indianapolis. In this work, we contribute an understanding of technologies currently used for caregiving coordination in the hospital, a stage-based account of coordination practices across the hospitalization journey, and provide design implications for CSCW tools in different phases. Each year, the parents of approximately 15,300 kids will hear the words, "Your child has cancer." When a child is hospitalized with a serious illness, family members must process a lot of stress and play a vital role in their child's care. They must take on new caregiving tasks and coordinate care. Most of the HCI and studies on connected care focus on patient-provider or patient-caregiver coordination. There's not enough work on family caregiving coordination in the hospital. There is a need to understand how collaborative technologies can help family members of hospitalized children collaborate and coordinate with each other during the stressful pediatric cancer journey. CSCW technologies could support and augment family care coordination work across cancer journey, help reduce stress levels, and improve families' ability to stay connected and informed. Existing HCI work suggests that cancer journey for patients has 3 phases. First, the screening and diagnosis phase, where a patient needs help to find a well-recommended physician. Second, the acute care and treatment phase, where they need information related to multiple treatments. Third, after discharge, where they seek advice regarding the steps to ensure long-term health outcomes. However, we don't know what are the caregiving tasks and coordination practices and how do they change across the cancer journey, and how caregiving coordination journeys can help design CSCW tools across the hospitalization journey. To address these 2 research questions, we conducted interviews with parents from 14 families with a hospitalized child with cancer, with the criteria of having their child hospitalized within the past year. To recruit these participants, we asked help from our medical collaborator, Dr. Emily Mueller, Director of Inpatient Oncology at Raleigh Children's Hospital. As a reminder, our first research question was, what are the caregiving tasks and coordination practices, and how do they change our cancer journey? During the interview, we asked questions such as, what a typical day in the hospital look like? How do you communicate and coordinate over caregiving tasks and other tasks? We use Otter to transcribe and Atlas TI to conduct iterative inductive coding and thematic. We conducted a second round of deductive coding using cancer journeys as a guiding, and we conducted journey mapping to understand the pain points, emotions, and opportunities for design across phases of hospitalization and across cancer journey. We characterized parents' technology use and communication practices based on the nature of communication, such as level of synchronicity, physical distribution, and number of members involved in the communication. We learned that most of the parents' communication during the hospitalization is mostly remote and mostly asynchronous, with a lot of texting involved. So text is always our preferred method of interaction, or we've already exchanged a bunch of text back and forth today about just different updates. Parents also engaged in real-time conversations, usually when it was time for important conversation, and they shared with us that their level of real-time conversations between them decreased during the hospitalization because one of them had to be in the hospital. And parents also use other tools as information management artifacts, such as using Glassdoor of the hospital room, binder, and notebook to coordinate and manage information about their child's care, such as information about medications, symptoms, scheduling, and medical providers' information. So in our work, we characterized caregiving responsibilities and coordination practices across phases of hospitalization. We also showed that there is a relational journey as to this characterization, where parents have to adjust their own relationship to these changes in caregiving responsibilities and coordination practices. So one of the toughest things that parents have to go through was the diagnosis phase, the early days after diagnosis. And some parents shared with us that they had to immediately shift to survival mode. And most of the times, both parents stayed together in the hospital during the early days. However, after that early first week, parents had to find new daily and weekly routines. One of the daily routines was sending daily updates that usually was through text during the morning to check in and stay in touch. Also, there was weekly routines during the extended hospitalization around shift changes, because the family caregiver, who was most of the time in the hospital, could go back home during the weekend and spend time with other kids or manage their other activities. And this caused problems where that primary caregiver could not be in the hospital. As one of the moms shared, that aggravates me to death, because I know what they're talking about and I know the questions I want to ask, and I'm not here to do it. So how caregiving coordination journeys can guide the design of future technologies? Future technologies could be designed, including checklists and recommendations, to prepare parents for these phase transitions. Shared calendars, task management systems, shared note-taking. These tools are usually used and designed to be used in the work setting. However, this experience of having a child in the hospital, based on what parents shared with us, is like a part-time job, and it's like a temporal work for them. So these technologies could be designed to support temporal work and cyclic caregiving coordination practices. Also, health updates, test results, progress tracking can be directly shared on the groupware platform, where all members of caregiving team could have access to that. In addition to that, all the features that I shared could be merged together in one place to reduce the burden on family caregivers from managing information on different platforms. We discussed that the concept of caregiving coordination journey allows us to recognize that caregiving needs changes, and learning about these transitions can help guide the design of future collaboration technologies. The phases and dimensions in our model generalize to other hospitalization journeys. We can design technologies to prepare caregivers for the transitions and even prepare them for the challenges of the next phase. We conclude that the concepts of caregiving coordination journeys and caregiving coordination cycles can be used as a framework in future studies that research the coordination within informal caregiving teams in a health crisis. We believe that our results can ultimately be transferred to similar contexts or situations where parents provide care to their hospitalized child for an extended hospitalization period, and more broadly to small-scale teams coordinating at distance. The key idea of this paper is that the journeys concept can be extended to caregiving coordination journeys, and that caregiving coordination journeys can guide the design of future collaborative technologies.